a really cool case, which is, to me, not just cool, but unbelievable. This is cartilage regeneration. So folks think that this is not possible with simple injections. This is a PRP, platelet-rich plasma, mixed with autologous, meaning from yourself, cells, stem cells, and other cells from bone marrow and from fat. We combine those, and they've been injected into this knee in this patient with severe knee pain. This is one slice of an MRI, really highly detailed. This is the kneecap looking down from the top. It's a slice through the knee, and you can see that this is the bone, and the outside of the knee is here. The skin is on top. There's a thin layer of tissue. Then it's the bone, your kneecap, and then this is cartilage, this gray line here, and you can see there's a big hole, a big chip out of the countertop. And this is a nice smooth glass-like surface. This is obviously not extremely painful. And then here's more cartilage, and this is the femur. That's the opposing side where the bones meet. And so you can see here that there's a large, we call this full thickness chondral cartilage defect, and pain behind the kneecap. This is another image of that. You can see that the defect is there, and actually there's a little bit of bright signal underneath the bone, and oftentimes this is an area of pain. This patient was treated, had amazing results, virtually pain-free for years, came back for treatment of the other knee, and we wanted to see what was happening with this knee, and we scanned them, did an MRI, and not expecting to find this, where that hole was completely filled in 4 years later by cartilage. And pretty astounding finding. This is not supposed to happen. This is not the natural progression of the disease process. If we leave it alone, it gets worse. And so if somebody sees this as far as like orthopedic surgery and the old paradigm, they're thinking, okay, this is, you can try to treat it and make it feel better. We're not going to heal it over time. It's going to get worse and you're going to need surgery. Some of the surgeries are pretty invasive, where they're doing, cartilage repair surgeries, where they're filling the defects with bone graft or cartilage, or sorry, not bone graft, cartilage graft. And there's new products that are coming out, but nobody thinks, including myself, that we could have injected this knee with a simple needle injection. You walk out of there, surgery, no major intervention, and that years later there's new cartilage that's developed. And even for the short term, the patient had relief of the pain within a few weeks, but long-term symptom relief, we thought maybe it was just the biochemistry, but here we're seeing actually change in the biomechanics, that there's new cartilage. So a pretty astounding finding. There's another view of this. This is looking from the side of the kneecap, big chunk that's taken out, and even some thinning and irregularity of the cartilage on the femur. This is looking at it from the side of the knee. This is the kneecap from the side, and it's dark, so femur, so the cartilage really stands out. And this is all fluid. This is the 4-year later mark where there's, that has filled in completely. And then here is the cartilage on the femoral side, which looks really good too. So pretty astounding that we're seeing these changes, and this is just an unexpected finding. Really exciting. And something that, do we see it every time? Maybe not, but just that it actually happens, really, it shifts that paradigm that, wow, this medicine is astounding. There's a possibility of it working, and how do we refine it, and how do we even track it? Like, should we be doing more of these for every patient, tracking them a year or 2 years out? And we might see that, hey, is it 50%? Is it 20%? Is it 80% of the patients that have these findings? But it's something that, when you see it in real life occurring, it really changes everything, and gives us even more confidence that what we're doing is in the right path. So thank you for listening today, and I hope you learned something. We will continue this series in all the different areas that we're seeing these types of imaging results. And come back to Regenerative Radiologist. If you like this, please hit the subscribe button, help out our channel, and we'll talk soon. Bye-bye.